My name is John Robertson. I'm a pediatric pulmonologist with Cook Children's in Prosper, Texas, and I've received an endowed chair to found the Exercise Respiratory Center, which opened its doors October 1st, 2023. Purpose of our center is to diagnose, treat, and research the causes of exercise-induced respiratory symptoms. These are symptoms most commonly seen in otherwise healthy kids, usually athletes, who have everything going on normal about them until they start running or until they start their sport. Then they develop shortness of breath, sometimes coughing, wheezing, chest pain, stridor, or just running out of gas faster than they should. Our typical patient is someone who exercises in their sport 8 to 15, 16 hours per week, yet they're not getting the returns on their exercise investment that everybody else is. The challenge here is that beyond asthma, the next two most common diagnoses are problems of function rather than disease tissue. Every exam they can do, every scope, every test, every imaging, it is all normal. And so it is only during exercise that the problems can be detected. The Exercise Respiratory Center is one of only 3 places like this in the country that does the type of testing and work that we do. Our goal is taking a patient in a controlled environment, exercising them hard enough, strenuously enough that they're able to reproduce their symptoms while we are looking at their heart, their lungs, and their airway for where the malfunction or malfunctions is located. The centerpiece of our test is how we look at the airway. One of the most common problems after asthma for these patients is something called EILO, E-I-L-O, exercise-induced laryngeal obstruction. The voice box or vocal cords are misbehaving. They're closing when you should otherwise be wide open for the high intensity and high velocity breathing that happens during intense exercise. The test in question to capture this is called a continuous laryngoscopy during exercise. We're the only center in Texas that's performing it. We performed the first one in the state in February of 2022. Simultaneous to this test is a cardiopulmonary exercise test, measuring their oxygen consumption and CO2 production, as well as the electrical activity of their heart, their blood pressure, heart rate, and the oxygenation in their blood, so that we can find where the problem exists while they're having symptoms. The endowed chair funding allowed us to basically make our own experts. Starting from these physical therapists and speech therapists, one of our first goals is to standardize the treatment programs that they find most effective. One of the barriers we face is that there is not a clean line separating abnormal from normal, and it's only been studied in detail in recent years, especially the interaction between the airway, the voice box, and the muscles of respiration. And so the endowed chair will allow us to add to this field of knowledge, as well as refining the tools for proper diagnosis to help us separate the normal from abnormal. Regarding treatment, no standardization currently exists in the medical community. One of our medium-term goals is developing the ability to do fairly accessible and easily used field testing for these problems, so that we can broaden our diagnostic net by going to where the patients are, on the field, on the track, in the swimming pool. We are adding to our diagnostic capabilities, both in the clinical and research sphere. Through the endowed chair, we have access to equipment that just wouldn't be in the realm of possibility if we had to rely on what is profitable in a business sense. We were able to do the first continuous bronchoscopy during exercise performed in a pediatric patient, or at least in the published medical literature. None of that would have been remotely possible without the endowed chair.